Hello there. Let me get us situated. Happy Wednesday. I am going to get colleague here. Naoya, yes. Let's get you joined in. So Naoya is coming in. Naoya is our amazing OT, and he's joining me live today. He's coming in here so we can talk. Woohoo!
It works.
Every time this happens, it's like, yes, we made it. And that was really fast, Naoya. So I'm impressed. And so Naoya and I are talking today about the autonomic nervous system as an influencer. And when I saw that first, I'm like, ooh, it's like the autonomic nervous system is like an Instagram influencer, social media influencer. I think it is right now. It influences so many things, but we're talking about it influencing the nervous system and neurologic disorders. And how do we know if it's influencing it, and what do we see? And I think honestly, I've learned so much from you, Naoya, in this realm. And so I feel very lucky that we have an interdisciplinary team that pays attention to these pieces from PT, OT, psychology, and it's kind of obsessed about it, I would say. We might be a little obsessed. So so we're going to chat about it. So I'm so glad you could join us, Naoya. And really, I want to start with in neurologic disorders. Like, we see a lot of people with movement disorders, right? We see a lot of people with Parkinson's. What is something that you may listen for or talk to a person about in their story that may tell you that the autonomic nervous system is contributing or influencing?
hmm Yeah, thanks, Julie. So I think with when I'm working with people with Parkinson's, in OT, I tend to work on fine motor skills, right? So typing, writing, phone use, things like that. And one of the things that people typically report is the tremor interfering with their function. And as you know, and some of you may already know, tremor can be amplified by the stress response, right? So the main thing that I usually ask for at the evaluation is to see if they've noticed that connection between the stress response and their tremor amplitude or severity changing. And sometimes people are very aware of it, right? They say, oh, like I already know that when I'm anxious, my handwriting is so much more worse. But sometimes they don't necessarily have that connection established in their head. And sometimes there isn't a powerful connection. But if I do suspect that that might be the case, I usually do some sort of functional activity at a treatment session, usually, to do almost like a guided discovery process to see if there is that connection between the autonomic and the function. So, like, for example, if I'm doing like an eating task, right, we might have a bowl in front of them and a spoon. And initially, we'll just do the movement without anything in the spoon, right? So it's just the movement. And a lot of times the tremor is a lot less pronounced, or maybe there's no tremor at all that day, depending on how they're feeling. And then we'll go like, let's change the task. Let's increase the difficulty a little bit. So we might add some beads there, or we might do water in the spoon. And sometimes if there is an autonomic component to this, you'll see a change in the tremor, either starting or the amplitude increasing. And that's like a really good learning moment for the patient, because we can ask like, hey, like I wonder what changed between that, because mechanically it's this exact same movement. The weight isn't really that different. And then it kind of highlights, yeah, like actually the fact that there's water in my spoon makes me feel a little bit more nervous, or I'm concerned about spilling, or whatever it is. And so that becomes a really good opening point to talk about the autonomic nervous system, see how that might impact tremor, fatigue, different symptoms, and other neurological conditions, and to actually try some interventions there, right? So some of the things that you might try would be deep breathing would be a good one to start with. And then down the line, you might dive even deeper into more like the cognitive side of things, cognitive side of things too, about the worrying thoughts that they might be having, or what else that might, other things that might pop up as they're doing these fine motor tasks.
Yeah, that's really great. I felt like I wanted to take notes because I'm putting together this little cheat sheet for our group and our Brain Bites group on autonomic assessment. And you said so many things in that, like them kind of guiding, and sometimes they're right out like a lot of people we work with are like, this is my autonomic system. Like I feel this with that. And so that's obviously very helpful. But I love how you made that really a discovery process with tremor, and we see that so much in Parkinson's. And yeah, and Lily, the brain PT, said love the spoon with water example, and I think we can also see that, Lily. That's a really great segue. We might take that into like a timed up and go test. And sometimes when we add that cognitive or dual task motor challenge, it's a similar thing. You know, if we think about our autonomic system being heavily influenced from a hierarchy level by the limbic system. So all of that, like amygdala fear response, is going to influence everything all the way down through our sympathetic, parasympathetic systems. And we may elicit that with a timed up and go where we added a cup of water to it in a very similar way that you might in OT with the, oh my gosh, if I had to hold a spoon still with water, I think my hand would shake too. So it's a great example. Now, I also know like we've shared some patients too who might have had a stroke, and they have said things like, "Oh my gosh, if it's really cold out or I'm really nervous, I feel like I have a lot of tone, or my foot turns in, or my arm does this," and 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 I'm thinking the same has happened for you too, and you might notice autonomic influence in stroke.
Yeah, when you said like the fear response with the timed up and go, like I was thinking about that too with my patient who had a stroke, and for her specifically, like being out in the community and walking, it was a was very challenging for her. And a big part of it, I think, had multiple components to it, but a big part of it was the fear of someone bumping into them, especially in a crowded environment. And then another thing was just like the um, like a lot of self monitoring during walking and knowing that she has an atypical gait pattern, and people might think that she has, you know, that maybe she's a little bit different, or maybe she has this condition, whatever it is. And so that made her feel very self-aware and conscious about her movement, which increased her stress response in that moment, which made the movement even more difficult to do. And so for her, yeah, like I think a lot of it, we actually started off with a lot of grounding, mindfulness, breathing techniques in sitting. So we weren't even doing it in like a movement-based approach initially, just so that she can get used to those techniques. And then once she felt comfortable, we were integrating that into her walking practice at home. She hasn't been able to do it outside yet because of the pandemic, obviously, but yeah, I found it really helpful to be able to say, hey, like let's see if you can get that relaxed state. When you're not feeling rushed, you move so much better. Can you actually do this when you're outside? I think that was the missing piece for her in many ways.
That's great. That's great. And then I know that we also work with a lot of people with either like a functional movement disorder or pain or post concussion. We've been working with a lot of people with really prolonged post concussion symptoms where we know the autonomic nervous system's heavily impacted by concussion. And I'm curious about your approach, OT approach, in some of those post concussion symptoms.
Yeah, I think with when I'm working with someone who has post-concussive syndrome, sometimes I'll look at the history, and sometimes people do have a long history of anxiety or just a really sensitive, hyperactive nervous system. And so some of the things that I'll do is to make sure that the grounding breathing techniques are doing what they're supposed to do. Because I know I've had situations where I'll lead someone through a breathing technique and then they feel worse afterwards, or they're not sure if they're doing it right, which I think is the hardest part about a lot of these breathing techniques is you can't see what's going on in their head. So sometimes it's hard to coach the person through those steps. So one thing that I tried this week actually that I found really helpful for one of my patients is usually when I do like a breathing technique, I'll do maybe 10 breaths at a time and I'll guide them through. And If they're new to it, I'll set up the environment in a really calming way. So the lights are dimmed and they're lying down. But even that 10 breath was a little bit hard for her because as she was doing the breath, her mind was getting distracted. And then she was worrying about the distraction, like, am I doing this wrong? Or I just can't focus. And that was kind of triggering the sympathetic response. And so one of the things that we tried was breaking it down a lot more, and practicing what's called the noting technique in mindfulness. I'm not sure if any of you are familiar with this, but one of the things that you can do with mindfulness techniques is when you have a really busy brain, whenever there's a thought or some sort of emotion or distraction, instead of letting those thoughts and emotions just take over everything, you're going to take a second to pause and label that as a mental activity. So, for example, if I'm being distracted, I'll say, oh, I'm thinking about dinner right now, for example, or I'm feeling this emotion of uncertainty, whatever it is. And taking note like that helps create a distance between that limbic system and the self-observing part of the brain, and can help with the grounding technique. But long story short, what we did was every 2 or 3 breaths, I'll pause her and ask her, hey, like, what are you thinking right now? And she'll respond, oh, like right now, I'm thinking about how cold my feet are. And then I reassure her, like, oh, that's good. That's good that you're noticing these sensations. That's normal for your brain to do that. Let's return to the breath. And we do that a few more times. And then she might go, oh, I'm thinking about the noise in the other room. Okay, that's okay. Your mind is wandering there. Just tell yourself, I'm thinking about something else, and return to the breath. So we were just working on just guiding the mind back to the breath without triggering other worrying thoughts. And I think that's sometimes with mindfulness techniques or breathing techniques, if people feel like they're doing it wrong, or if there's like a perfect standard that they're supposed to hit as they're doing it, that could be one of the barriers to relaxation, right? So yeah, I feel like there's so much to talk about with mindfulness techniques, but in a nutshell, what I tried this.
Yeah, well, that's really helpful. And I love how you kind of take that from their story to assessing, and your assessment is kind of your treatment at the same time, and you're constantly evaluating. And, the recovering perfectionist in me really understands when you're like trying to get the breathing right. When I first took mindfulness-based stress reduction courses, many years ago, that was like me. I've been there. So I really, really understand that. And I think a lot of people that we work with, that's why like kind of a generic, like try this app or try this technique doesn't always work for people. And then they go, oh, that didn't work. Or I don't like that. I don't want that. And that's why I think a real personalized approach and understanding that everybody's autonomic influence is different too. Some people may actually be not hyperdrive, not on the sympathetic, they may actually be in the parasympathetic, and some of these things may actually make symptoms even worse in that state. So that's why we assess it, and then work towards treatment. And in Parkinson's, in stroke, in concussion, in functional disorders, in pain, I mean, literally everything has there's an influence. So Naoya, I'm so thankful that you joined us today to really bring your perspective and an OT perspective to this topic. And we have on Friday, we're going to talk more about assessment. I know people are really interested in heart rate variability and some of the other assessment techniques. We'll dive into that. And then on May 1st, actually pending a baby coming, right, Naoya?
Yeah.
Naoya is going to join us for our free webinar. We're hosting a free webinar on everything autonomic. Get your basics, get your anatomy, assessment, treatment, all in one place. It's a free webinar. We're super, super passionate about this, in case you couldn't tell. We're actually going to have we're going to have Naoya take us through some of these practices as therapists. It's really important to practice yourself so that you can take somebody through this. So Naoya will lead us through those as examples that you can then practice and take to the people that you're working with. This is something I wasn't even familiar with when I started my career, and it really wasn't for like the last 7 years or so of being able to work with other people who have explored this and researched it. And I I feel bad for some of the people that I didn't know this about, before. So that's why we're passionate about sharing this. That's why we have a free webinar coming up on May 1st. There's a link in our bio for that. It's also reactiveeducation.com / autonomic webinar. So that's May 1st. We'll both be excited to see
Mhm.
you there. And thank you so much for joining us on this Wednesday. It was great to see a lot of people on here live.
Yeah, thanks,
And
Julie. Thanks, everyone.
yeah, thank you, Naoya. We'll see you later. Bye.